This video is an explanation of the operation details of the Clothoid vascular closure system. Do not lift the lever at the beginning of operation. It will shift the position of the white suture to cause a connection failure. Next, we will demonstrate the operational details and key points. Advance the device through guide wire. Withdraw the guide wire when the guide wire exit port is just above the skin. When you feel that the device is about to reach the right position into the vessel, it is important to slow down the speed of inserting the device. Do not push it fast into the vessel. By pushing hard and fast, the device will possibly go deeper than the operation position. You'll need to draw back the device to place it in the right position. Therefore, to avoid the back and forth movement in the vessel, it is recommended to push slowly. Stop immediately when you see a brisk pulsatile flow of blood in the marker lumen. Lift the lever to deploy the foot in the vessel. Pull the device gently against the intravascular wall, and be 100% sure that the device forms a 45-degree angle with the vessel wall before the next step. Now, we can see that the foot of the device adheres to the intravascular wall. Then we'll push the needles. There are two ways to push the needles. The first one is to hold the device body with one hand and push the plunger with the thumb of the other hand. The second one is to hold the device with the index finger and the middle finger, then push the plunger with the thumb of the same hand. Always keep the device in the 45-degree angle position and slightly lift it against the vessel wall. Do not shake or move or twist the device in this process. In this video, I will use the first method. The force and speed to push should feel like when striking a lighter. Do not push slowly. There will be a click sound indicating the needles are pushed into position to form a successful connection. Next, we pull the plunger out steadily. The direction of pulling should always be in line with the device body. Be aware that the suture cannot be pulled to the left or right direction. Cut the suture at the cutting place when no more sutures can be pulled out. The suture should form a certain angle with the cutting blade. Close the lever after the suture is pulled out. Push the lever back and slowly withdraw the device until the blue sutures are visible. Holding the sutures with fingers to pull them out from the device. Continue withdrawing the device until it is completely removed. Now, we can see a longer straight limb and a shorter curved limb of the blue suture. Then we need to use the suture pusher and cutter. Pull back the yellow button of the suture pusher and cutter. Place both the longer straight limb and the shorter curved limb of the blue suture into the tip part. Make sure the suture pusher and cutter can be moved smoothly along the sutures. Wrap the longer straight limbs of the suture in round the fingers. Put the thumb of the other hand on the handle pusher of the suture and cutter to place it to the right position. Then push the suture pusher and cutter with a slow, consistent increasing force, until the suture is taut and the knot cannot be pushed any further. Holding the shorter curved limbs of the suture with fingers, and push the suture pusher and cutter at the same time to tighten the knots. Ask the patient to cough or bend the leg to confirm the suturing is successful. In the end, pull the red trigger of the suture pusher and cutter to cut the sutures over the knots. Finally, we have finished all the procedures to operate this device. Please find more information in the Instructions of Use and Surgical Techniques file.